right now you're known for being a big advocate of a low carb diet, intermittent fasting. At what point of your career did you start to realize that things were not working the way you wanted to work? And what shifted you in this direction of fasting and low carb prior to how you worked on your patients before? What happened in your career?
So what happened was that we saw, so kidney disease, the most important cause of kidney disease, really by far, is type 2 diabetes, which is obviously very closely related to weight gain and obesity. So the way I was taught, and everybody is taught, we learn all about medication, surgeries, procedures like dialysis, but you don't learn a lot about nutrition. So I really had no interest in any of that. It really wasn't considered part of the sort of medical specialty. It's sort of like that's what dietitians do. It's not what doctors do, sort of idea. And I thought like that for a long time as well. And it came to about sort of probably around 2010-ish that I really started to think that this is actually quite wrong, because everybody knows that if you are overweight, you get type 2 diabetes, which gives you kidney disease. To treat the kidney disease with medications at that point is really the least effective way to treat people, because you know the entire process. Therefore, if people don't gain weight, they don't get type 2 diabetes and they never get kidney disease, as opposed to treating the kidney disease at the end with some medications, which are of variable use, and then eventually holding their hand as they go on dialysis. So it was very unsatisfying to me to know that there's a disease that is sort of preventable, but I wasn't doing anything to prevent it. I was just seeing them when they got their kidney disease and then said, oh, here's some medication for you. And that's not what I signed up for. I'm there to make people better. So therefore, that's where I really, really sort of became very interested in the question of how do you lose weight? What causes weight gain? And the real question was, to me, and I thought about it in a very medical sense, is what causes weight gain? Because that's the way you approach things. So if it's your appendix that's giving you problems, you need to know what the cause is so you can treat it. You don't just say, well, you have pain in your tummy, here's some Tylenol. That's not the right approach, because you haven't taken care of the actual issue. So you have to really look at what the root cause of the disease is. And that's really what you should be doing in order to be successful. So then that's when I really, really started to look at the question of what causes weight gain. And I think that's a question that not a lot of people ever thought about, because we all thought it was pretty obvious. Well, too many calories, calories in, calories out. And as I looked into it further, I realized that the whole calories sort of story is just not scientific at all. It's terrible. It's like the whole thing is all wrong for a lot of reasons. And that was the first sort of moment I thought, well, this is sort of strange, because everything I thought I knew, everything I've been taught in terms of weight gain and obesity, which is so important for so many of these diseases, is actually completely and utterly incorrect. You can go back and you can look and you can say, okay, well, are there any randomized control trials, which is sort of the gold standard of medical evidence, that calorie reduced diets will help you lose weight? And like, no, there's not. Is there any, practical experience? I was like, yes, literally billions of people have done calorie reduced diets, and like virtually none of them lose weight. So it's not like it was super successful. It was like super unsuccessful. And yet I, as a physician, was pushing these calorie reduced diets because that's all I knew. And I thought, okay, well, that's got to change. So that's really where I started to think about it and really, go back to sort of basics and say, what is causing weight gain and so on. And that's sort of what led to the obesity code, which is talking about really what the underlying cause of weight gain is. Then I came to the second question, which is that once you realize, okay, what causes weight gain? And, for a lot of people, it's really hyperinsulinemia, or too much insulin in the body. Then you come to the second question, which is very important in terms of treatment, in terms of what are you going to do about it? So there's several strategies to reduce insulin, obviously. So we're focused on calories when we should have been focused on sort of the hormone insulin. So you can lower it with carbohydrate-reduced diet. So that is successful up to a certain point. But then I thought, well, I tried it for a lot of patients, and some were successful, some were not successful. But then I thought, well, there's got to be like a better way to do this, because, obesity in the 1970s is virtually non-existent. And now it's sort of like 70% of the American adult population. So that's when I started to think about fasting. And of course, the first thing I thought was, wow, that's a really, really bad idea. And it was the same process. I was thinking like, okay, well, wait a second here. I think it's a bad idea, because that's what everybody tells me. Oh, you're going to go into starvation mode, and you're going to be so hungry. You're going to be forced to stuff donuts in your mouth. But then I thought, okay, well, let's think about this for a second, and let's look at what the medical literature actually says about fasting. And again, the same thing is like, it was completely the opposite of what I thought I knew, which is fascinating and a huge opportunity, because, hey, if here's a strategy that has been used for thousands of years and nobody's using it, then I can use it and make people better. And what was interesting was that as I started to introduce some of this stuff to patients, and because, that's what I do, I see patients, some of the stories were just incredible. Like, and we published a couple of these. We published a case series on a couple of these. And essentially people with 20 plus years of type 2 diabetes, it was like gone in like, a month and a half sort of thing. And these were patients I was treating. I'm like, whoa, I just treated you wrong for the last 10 years because I just took away the whole thing just by changing your diet. And it's not easy. So, I don't want people to get the impression that, oh, hey, just make this quick switch and it's, all sunshine and unicorns. It's tough, and you got to stick to it. You got to work at it. Fasting's less fun than, say, eating pizza and donuts. So you have to really give people the support and the education that they need. And a lot of people were dead set against it because their doctors would tell them, hey, that's the worst thing you could do. And in fact, just this morning I saw a patient and they said the same thing. I had told them, hey, you should do some fasting. They went to talk to their physician and their dietitian. And then he came back to me and said, I haven't done it because they told me it's the worst thing I could possibly do for my type 2 diabetes. I'm like, well, you can do whatever you like, but his A1C was like 10. So it's like he wasn't doing great on the standard diet. So that's sort of how things came about, that I really became really interested in sort of both weight loss and intermittent fasting as a treatment, because low-carb diets had been around for a long, long time. They've been around since Atkins and successful to a certain degree. And of course had been really coming back in terms of ketogenic diets, which was slightly different than sort of, and even paleo diets, sort of variations on Atkins style diets. But nobody had really been talking about intermittent fasting, especially like 5-6 years ago when I really started talking about this. Nobody was talking about intermittent fasting. And it's sort of, when you think about it, it's actually the most obvious thing that you can do.